I'll tell you, it's one of the most rewarding time periods in my life, being stationed in Afghanistan in a small, what we call FOB, Forward Operating Base. We had a group of about 20 or 21 people in a very busy area in a very busy time when we were in Afghanistan. We saw over 650 cases, trauma cases come in a 6-month period. So we were very busy. Some of those were very severe injuries. To me, it was the relationships that we developed with the patients and with each other. It was, again, the most rewarding experience of my life, in that we got to care for the coalition forces, something I look back very fondly. I'm glad that we all made it back. I was, I wouldn't say that it was always fun and games, when we were there, but when you look back, it really is, there's no better way to describe it than immense pride, for the people that I served with and were able to help. Well, I think that's the great thing about a general orthopedic surgeon is that we exclude no one. For the most part. I take care of shoulder, hip, and knee arthritis, both surgically and non-surgically. Probably my niche, if I had any particular niche, is I also do hip arthroscopy, and I'm one of the few people in the community that do that. So young people with hip pain that have what we call femoral acetabular impingement will often show up in my office. When I was in the military, they would send people from 3, 4, 5 states around to Wright Pat to be seen. Here in the community, that word is now kind of getting out, and we're starting to see more and more patients that are showing up at our door specifically to discuss the possibility of hip arthroscopy for their pathology. I think what makes me unique is a little bit of that background. That when you are in the military, you can kind of speak that language. So there's a lot of people in this community that have that background. I think the other thing is I try to take the time to explain things to people, and that's one. If I've had one overarching positive comment from patients, it's that I do tend to try to take time to draw out diagrams and kind of show them what it is that the pathology that they're experiencing and how a treatment hopefully that would be rendered to treat that, whether it be non-operatively or operatively, can help achieve that objective. That's part of my patient philosophy as well, is to try to take the time to listen to the patient. I think listening is the most important thing we can do. We shouldn't come in and talk over a patient because we think we know what's going on. If we listen long enough, the patient will illustrate exactly what the problem is, typically. I think developing that empathy and compassion for your patients is important in their treatment and helps steer you towards the right answer more often than not.